Hello again, welcome from the Vancouver 2018 Future Technology Conference. Next to me it's Nico Preston. He works at the University of Victoria, and Nico is interested in the interaction of global ecology, computing and health. And on the Future Technology Conference he submitted a paper on a peer network called the NALPAL to function as a lifeline for opioid users. Welcome, Nico.
Thank you very much.
Good to have you.
Very nice to be here.
Yeah. Hey, how did you come up with the idea to put technology to work for this specific audience? And how did you get involved in this project?
Sure. So I've always sort of been interested in the intersection between technology and sort of implied societal problems or crises. I'd done some work in the infectious disease space, and over the last few years had turned interest and attention to the opioid crisis working in the United States. I found a group of researchers at UVic with whom I've been collaborating in their computer science department who had initiated this work on opioid users, and I've been assisting them with the design and implementation of this NALPAL network.
Yeah. Hey, how does the naloxone peer alerting Lifeline work? That's NALPAL, and how is it different from the original PAL?
Sure, so the idea with the PALs is the idea that everyone has a cell phone on them, and cell phones are loaded with a number of useful sensors. Your location, environmental conditions, even the well-being of the individual carrying the phone. Our goal was to make those sensors, put them to work from a public health application to provide sort of a lifeline to individuals outside the traditional healthcare system who were exposed to risks through opioid drug use. The idea being to allow them to connect with a network of peers to get the support they need at time of crisis.
Yeah. Hey, what are the success rates of NALPAL, if available?
Sure. Right? So we've just started prototyping the system. We've run into some barriers around networking, some sort of research level problems that we're attempting to resolve. But it's a challenging community to interface with. There are some trust challenges, some of the activity is illicit, and so in trying to extend a life raft to this community, we have to work very closely with community organizations and groups who are already in place and working hard to reach out to these individuals.
Yeah. Hey, you describe the target audience as people who are increasingly isolated and are using opioids alone. How do you reach these people, and are they capable of using NALPAL?
Well, that's precisely the challenge. The statistics point to overdose rates being disproportionately high among isolated and increasingly rural users. It's tipped from being an urban problem to being a rural problem. And we're finding elevated rates in suburban communities where perhaps someone's child is in the basement struggling with addiction and using these drugs alone. Our product itself is not necessarily designed for the individual themselves using it to call for help, but to help them pre-plan and be aware of risks and put a network in place among peers and family members who could assist in a crisis. Yeah. So they are a challenging group to reach.
Yeah. Hey, how do you determine what is the private and trusted network of contacts who are sympathetic to the individual's specific needs, and how do you make the end users of NALPAL to trust the network?
Well, so it's the end users themselves who define the network, and I think that's a broad trend in computing is towards decentralized and modular networks. So the idea is much like your contact list. You would say, I have these 5 friends I know and trust, and if something goes wrong in my life, I want to reach out to them. And that's really the premise of PALs in general, is surrounding yourself and connecting yourself to people who can assist you in a time of need.
Yeah. Hey, to what extent is sufficient data on the target audience of opioid users available to create meaningful insights, for example, recurring patterns, or what they might need? What sources are available?
Yeah, so the information is sparse, and the data we have is concerning. So the opioid overdose deaths are leading to a decline in life expectancy across North America and worldwide. What data we can get, we often glean from sort of syndromic or indirect metrics. There are creative groups looking at pharmaceutical loads in sewer effluent, and groups, we were involved in a group who were doing online listening, looking at how people were discussing their drug use behaviors and patterns. Yep. And we rely on that type of information. Because it's illicit, people don't volunteer their information. And so we've been coming up with creative ways to reach out and support these groups. But I think community programs, community support networks are sort of at the forefront, the shelters, the other resources in our communities are bearing the brunt of it, as are our paramedics. And we have an onus to develop new tools to support these groups.
Yeah, cool. Hey, if I understand your work correctly, the NALPOL is aimed at individuals facing an overdose. How could NALPOL also be used to get individuals off opioids, or maybe even prevent people from starting to use opioids?
So that's a huge challenge, and not necessarily where we see ourselves being able to impact the epidemic. I think we're providing resources and information and sort of a bit of a safety net to support individuals, but really an individual, the path we're seeing by which people are becoming sort of involved in opioid use is complex. There are pharmaceutical on-ramps, there's illicit drug use, there are a lot of ways people get involved in this community, and our hope is it's the individuals themselves that find a way to balance a healthy life with these other risk factors. So I think we're providing information, resources, and a support network, and trying to supplement existing medical services in assisting these individuals.
Yeah. You have any feedback from the broader health community, like doctors, insurers, government?
Sure, it's a mixed bag. There is some genuine concern about solutions such as ours. The concern is that we're task shifting individuals away from high-end medical services who should be assisting them. But what we see is some of these individuals are not reaching out to emergency services because they risk losing their housing if an ambulance is called to a response. So they're already vulnerable groups who could be more vulnerable through their interactions. So this is very much a supplementary lifeline. In general, our aim and goal is to involve the medical community. They are the best qualified to handle this. This is another tool to help provide support when people have fallen out of the system.
Yeah. One last question.
Sure.
What's the biggest challenge to further develop NALPOL?
I think there's some technical challenges, among them accurate GPS positions inside buildings, mesh networks in low cellular coverage areas, but then there's a social barrier. There's getting people to trust and use the technology. People have genuine concerns about privacy and their mobile device use, so we're trying to design the technology with input from community groups and the users themselves as to what they are willing to compromise in terms of privacy in trying to be safer.
Nico, thank you so much.
Thank you so much for having us.
And when you liked this interview, go to the website of the Future Technology Conference, because there are a lot of very interesting interviews over there. Thank you for watching.